Hello everyone, I'm Dr. Shantanu Tandon, the Head of Department of ENT at Sakra World Hospital. Now tonsils are these glands which are present inside the throat at the back. And a lot of times I'm asked, when should we get these tonsils removed? Do we really need to do so? Now broadly there are two reasons why which we should consider a tonsillectomy or a tonsillar removal. One, if you are getting recurrent infections, that means every year you have 2 to 3 infections which continuously cause pain, fever, difficulty in swallowing, and we end up taking antibiotics for it, you would be a candidate. But more often nowadays, we find patients who are constantly mouth breathing, they are snoring, and that's because the tonsils are not only infected in the past, but they are very, very large. And when they're large, they obstruct the flow of air. In children, this is very, very common. Large tonsils, mouth breathing, snoring, poor quality of sleep. So, broadly, if you are constantly affected by infections, you may need to get the tonsils removed. And if it is obstructing your airflow, then also you may need to get the tonsils removed. One good thing is that with some of the newer technologies like coblation, we are able to do this in a very rapid, relatively painless and practically bloodless manner. And in children, there is a relatively new concept called a intracapsular partial tonsillectomy or a subtotal tonsillectomy, where we can actually leave a thin sliver of tonsillar tissue behind over the inner capsule, and what that does is it allows us to give a even less painful post-operative period. Thank you.